Hello everyone. So today we are going to discuss autism spectrum disorder and how you can approach if such a case ever presents in exam. So first of all, I will tell you the core symptoms and other symptoms of autism so that you can look for these symptoms in a patient and confidently rule out other differential diagnosis and provide management. So autism spectrum disorder, as the name suggests, it's basically a spectrum. So some of the people that are on the lower range of the spectrum will have few symptoms and they will be more independent, where people at the higher end of the spectrum will have much more severe symptoms and they may be dependent completely on their carers. So there are some core symptoms of autism that are present in each and every case, and they are known as autistic aloneness, insistence upon sameness, and presentation in the early development. Okay, and they can be memorized by the basically the name of the disease, which is autism spectrum disorder or ASD, where A stands for aloneness, S for sameness, and D for developmental, that is presenting in early development. Now, what is meant by autistic aloneness? So basically, people with autism are basically loners, and they are not much interested in social communication, and they would like to be left alone. Okay. So the parents of these children frequently report that they're not interested in playing with anyone, any other kid, and they're just playing alone in their room. They are not much interested with an interaction even with family members. Okay. The second is insistence upon sameness. So these people follow a strict routine, okay, a carefully planned out strict routine, and they want their environment to be same, everything in their daily life to be same, and any change, however minute it may be, can be disastrous for these people. Okay, and they get really, really upset when anything in their routine or in their surroundings, environment, in their daily rituals is changed. Presentation in the early development, this is another core symptom. So autism presents in the early childhood. So these people, when their parents or when you're taking history from an adult with autism, or when you are taking a history from their parent, they will tell you that they have been the same all their life. So it's not like other illnesses like schizophrenia or depression that might develop later in life. These people are born with these symptoms. Okay. And it's not episodic, like it's not there a autism is not something that is there in one sitting, like for example at home, and then the child behave normally at school, or they for a few days they behave weirdly and then they are normal. Autism symptoms are there throughout their life. Okay. All right. Regarding the cause of autism, nobody knows what is the cause. There is no known cause. There are some genetic factors that are suggested to play some role, but there is no evidence for that as well. There is definitely no link with any vaccination. There was previously only one study that was linking MMR vaccination with autism, but that study has also been debunked now, and there is absolutely no link autism with any vaccination. Okay, rather it's a neurodevelopmental disorder, which means that um, it's just their brain develops in a different way during their early development. Okay, other symptoms of autism are speech delay. Speech delay is actually the most common presenting symptom for autism. So the healthcare providers are first contacted when a parent notices that their child is not speaking much or not speaking as much as other children. Okay, so speech delay, again, autism is a spectrum. So it can be a mild speech delay, which means that a child might start talking later in their life, or it can be complete mutism, where the child is not able to speak any word at all, even later in the life, and it's just only able to produce some sounds or screams, but not actually talking. Okay. Then another symptom is they struggle a lot while understanding or using body language and expression. So, for example, these people, they're not able to tell whether someone is happy or sad by looking at their facial expression. Okay, they are not able to understand sarcasm. They're not able to use their imagination a lot. Okay, they also struggle in expressing their body language or their own expressions. They don't give much eye contact. They don't smile much. Um, So this is a struggle for them to understand how other people are thinking and feeling and to express their own thoughts and feelings. Okay, repetitive behavior and highly specific interests. So people with autism, they might do some repetitive behaviors, which are also known as stereotype movements or tics. So they might be flapping their hands, their arms in the air, or might be, taping something or swinging around the room, or jumping up and down. So some repetitive movements with their body, and they also have some highly specific interests. So, for example, a child with autism might have a certain favorite toy and he plays with their toy all day long, 7 days a week, and doesn't get bored with it. Or he may be playing with some specific, specific music instrument, or listening to a particular song, or reading the same book over and over again. Okay, or demanding to eat the same meal each time every day. So these are some example of highly specific interests. All right, so for diagnosis of autism to be made, these symptoms must be observed in multiple settings. So you cannot diagnose autism based on one presentation and in one setting. So for example, if the child first present to you in a clinic, you cannot make the diagnosis on the first meeting with the child in a single setting, that is the clinical setting. So you need to observe the behavior of the child in the clinical setting, at home, at school, or in nursery in order to come up with a diagnosis, and that will require multiple sessions. Okay. Data gathering. So how to take a history of a parent present with suspicion that child might have autism. Um, so there are basically three parts that need to look for in history. Number one is eliciting the main symptoms of autism and ruling out other differential diagnoses. Other differential diagnoses are other neurodevelopmental disorders like ADHD, conduct disorder, or maybe gross developmental delay. Okay, prenatal history and developmental history. As autism is a neurodevelopmental disorder, you need to take the prenatal history. Um, so whether the mother experienced any complications before the birth, how was the delivery, any complication during the birth, and how was the development of the child. So you need to ask about all the developmental milestone and also compare with the developmental milestone of any siblings that might be there, just to get an idea. All right, and then I'll ask about comorbid conditions. So any other conditions that might be present. So autism frequently is associated with some other comorbidities like epilepsy or seizures, and anxiety or depression as well. So you need to ask about those conditions as well if you have time. Okay, so first of all, we will start with open-ended question. We'll ask the parent whatever the symptom that the parent presents with, we will ask them to tell us more about it. Okay, and then we will elaborate the presenting complaint. So as we have already established, the most common presenting symptom for autism is speech delay. So if the child presents with speech delay, you cannot right away suspect autism, because autism is a comparatively rare disorder, and its prevalence in population ranges from 0.1% to 2%. Okay, so it is a rare disorder. So first of all, you will exclude other common causes of speech delay, like hearing problem, like cleft palate, which is basically a mechanical problem. Their lips and palate are not fully developed, so there is a delay in talking. So we first of all exclude those. So we'll ask, first of all, we'll establish the severity of speech delay. So we'll ask if he says any word at all, any sentences at all, and then we will rule out hearing problem. We'll ask whether he responds to his name, and was a hearing screening test done before? Because in the UK, the hearing screening test is done at birth. Okay. So we'll rule out the hearing problem. We'll ask about cleft palate, any problem noticed with the lip or palate, any history of difficult suckling, okay? And then we'll ask about the autism questions. Then we'll ask the autism question that whether, the autistic aloneness, insistence upon soundness, etc. If the presenting symptom is difficult behavior, again, we'll ask, can you please tell me more about it? Since when has he been behaving this way? If is he behaving this way all the time, or in a certain specific situation, and any obvious trigger for him? Has he been this way, all his life, or is it more recent? Okay, so you will further explore the behavior and then ask autism questions. confirm the diagnosis. So, what are the autism questions? How are you going to ask the autism question? So, autistic aloneness is the first symptom. How will we ask about autistic aloneness? We'll ask, does he enjoy being with other kids or family member and doing things with them? Okay, so does he enjoy being with other kids or family member and doing things with them? Um, if they, most probably they will say no, because the core symptom of autism present in each and every case. So we will ask, has he or she always been this way, or is it more recent? Because in autism, a child will be this way, from day one of his life. But if it is because of some other cause, because of a trauma or recent stress, then it will be there will be a more recent history. How does he cope with any changes in his routine? So this is basically a question about insistence on sameness. How does he cope with any changes in his routine or environment? Okay. So obviously the answer here will be he is really upset and he screams and he shouts and he bangs his head on the wall, because this is another core symptom of autism that is present in each and every case and is absolutely essential for diagnosis. Okay. Then the third question is about difficulty with body language and expression. So this is the third part. So we will ask, does he give eye contact? Does he smile at you? Okay. What does he do to show that he is upset? Okay, because these children, they have difficulty in communication, so they are not just able to tell that they are upset, but they may, scream and shout and bang their head on the wall and, you know, um, wreak a havoc on the home if they are upset. Is he able to notice when others are upset or happy? Okay, so for example, you'll ask the mother, what does he do when you are upset or happy? Okay, that might tell us he doesn't even notice, because these children cannot tell how someone is feeling by looking at their expression. So difficulty in expressing body language and understanding body language. There was a third question. The fourth question is about repetitive movements. So does he have any repetitive movements like flapping hands, spinning, etc.? Does he have a special interest in something? Does he have any particular collection? Okay. So these are basically the symptoms of autism, and this will give you an idea of whether or not you can suspect an autism in this child. Then we will also rule out ADHD. We'll ask the parent if the child has any difficulty in sitting still or waiting for his turn, because ADHD children, they cannot sit still. They will be always fidgety, running around, and they cannot wait for their turn, and they will speak out of turn. Is he able to concentrate on one task for a long time? So this question is again very important. So autistic children, they can concentrate for a long time, even more than normal people on one task, which is of their interest. So for example, if a child is interested in reading a certain subject, he can spend, hours and hours and even days to read about it. But for kids with ADHD, this is not possible. So they have their thoughts jump from one place to another, and they are not able to. They will start one task and then they will, leave it incompleted, and then they will go to other task. Okay. So concentration is really a problem for kids with ADHD. So this is a differentiating symptom. Then we'll ask about medications, any other medical conditions your child might be having, any past medical condition, any history of seizures, etc. Then any allergies, any other medication that a child might be taking. Then prenatal and developmental history. It's really important in autism. This is basically the bird of pediatric history, where you ask about birth. But in this case, we'll also ask about before birth. So when you were pregnant with, for example, Adam, was there any complication during your pregnancy? How was the delivery? Was there any complication? Was he admitted to the NICU? How was his development? Did he achieve all his developmental milestone in time? Age at first smile, age at sitting, age at walking. Does he have any other siblings? How was it in comparison with his siblings? Okay. So this is really important here, because there is a certain amount of developmental delay in kids with autism. Also, you need to rule out global developmental delay. So for example, global developmental delay is not autism. It's something that the child is basically, we call as learning disability, where the child is lagging behind in each aspect of their development, whether it is speech, social, motor, fine motor, or gross motor. or whatever, then it is known as global developmental delay. So if a child is lagging in all aspects of development far behind their other siblings, then they will be known as global developmental delay or learning disability and not autism. So you will be able to rule out that thing as well when asking about developmental history, but that's really important in cases of autism. Okay, then you will ask about ideas, concerns, and expectations. Examination, only observation and general physical examination. There's no specific examination that you can do in cases of autism. And management. So if you are in the GP clinic and this child presents to you in the GP clinic with speech delay and taking history, speech delay or difficult behavior or whatever, and on taking history you suspect autism, then you can only tell the patient that you are, the parent that you are suspecting autism. You cannot diagnose autism, as I also already told you previously, that this requires many sessions of assessment in multiple settings. Okay, so you need to refer this patient to the autism assessment team. So you'll tell the parent that from what you told me and what I understand, I suspect that Adam might have a condition called autism. Okay. Autism is not an illness, it just means that his brain is wired in a different way. So just like different people have different eye color, different skin color. So sometimes the brain is also wired in a different way. It works in a different way. And this is known as autism. Autism is a spectrum, which means that it is different uh, for everyone. Everyone with autism is different. But in general, these people find it difficult or hard to communicate with others and understand how other people think or feel. And they like to do the same things over and over. So you're basically telling him the core symptom, telling the parent the core symptom of autism, that they find it hard to communicate with others, which is autistic illness, and understand how other people think or feel, which is basically difficulty in expressing or understanding body language, and like to do the same things over and over again, which is insistence upon sameness and repetitive behavior. Okay, so you'll tell the parent, would you like to know what we are going to do for him now? So what I'm going to do is I'm going to talk to my seniors and arrange a referral for him to the autism assessment services to confirm the diagnosis of autism. Autism assessment team include a child psychiatrist and a children doctor along with other team members like nurses, etc. Okay, so a child psychiatrist and a pediatrician. They will arrange multiple sessions and will do further evaluation to confirm the diagnosis. Okay, so even the autism assessment team cannot diagnose the child in one session. They will arrange multiple sessions, ask further questions, do further evaluations to confirm the diagnosis of autism. Once the diagnosis is confirmed, then he will be managed by a multidisciplinary team, which will include a language therapist, language and speech therapist, occupational therapist, psychologist, etc. And he will be supported in every aspect that he needs support with. Okay. So that was all about autism spectrum disorder. I hope it was helpful. If you like my videos, please leave a comment. I really wait for your comment, and I'm really curious about whether it's helpful or not and how can I improve. So please leave a comment, and if you like the video, then put a like and subscribe my channel if you haven't already subscribed. And I will see you soon with the next video.